We carry out the Silhouette Soft treatment to lift the midface. The treatment is performed under local anesthesia. The anesthetic solution is injected into the entry and exit points of the sutures. The total quantity of anesthetics shall be approximately 3 cc for each side of the face. Once the first side has been injected, we proceed to the injection of the anesthetics in the second side with the same method and the same amount of product. The instruments needed for this treatment are as follows: the Silhouette Soft Sutures, a pair of sterile scissors, sterile gauzes, skin disinfectant, and 2 sterile drapes, one for the table and the other for the patient. Each pack contains 2 Silhouette Soft Sutures. Once the sutures are extracted from the pack, we tighten the knots. We use a 19G needle to make a puncture at the entry point. Once the entry point is punctured, we use the 12 cm suture needle to introduce the first half of the suture itself. It is very important that the needle of the suture is introduced vertically through the entry point to approximately a 5 mm depth inside the adipose tissue. Once the tip has been introduced, we rotate the needle to a horizontal position parallel to the skin in order to introduce it into the adipose tissue. We guide the needle on its way to the exit point and we puncture the skin. Once the first needle of the suture has been cut, we introduce the first 4 cones into the tissue with a mild traction. Now we must insert the second half of the suture in the opposite direction. It is very important to insert the needle tip in a vertical position through the entry point to a depth of about 5 mm. Subsequently, we place the needle horizontally and parallel to the skin, and we introduce it in the adipose tissue until it reaches the upper exit point. The needle is extracted so that we can bring the free suture inside until the first cone reaches the entry point. We cut the needle from the suture, and with a mild traction we insert the cones into the adipose tissue. At this point, the first suture is completely inserted, and we can insert the others with the same method. The entry point is made with a 19G needle. The first needle of the suture is inserted in a vertical position through the entry point to about 5 mm depth and is rotated parallel to the skin in order to insert it inside the adipose tissue at the correct depth. The needle is extracted until the first cone reaches the entry point. Then we cut the needle and insert the first 4 cones. We proceed to insert the second half. It is very important to introduce the needle tip in a vertical position through the entry point to about 5 mm depth. Then we rotate the needle horizontally and we proceed towards the exit point. We cut the needle from the suture and we conduct traction to insert the second half of the suture with the other 4 cones into the adipose tissue. We proceed to insert the third and last suture of this side of the face. The entry point is punctured by using a 19G needle. Once the suture has been removed from the pack, we tighten the knots. We proceed by inserting the first needle of the suture in a vertical position to a 5 mm depth inside the tissue, and we rotate the needle horizontally to reach the corresponding distal exit point. Once the needle has been cut, we proceed to insert the first half into the adipose tissue by applying a mild traction. We now insert the second half of the suture with the needle in a vertical position inside the same entry point to a depth of 5 mm. We rotate the needle horizontally and head to the upper distal exit point. Once the needle has been inserted, we extract the suture, cut the needle, and insert the second set of cones inside the tissue in order to complete the insertion of the 3 sutures of the first side. Once all sutures have been inserted, we compress the adipose tissue. The compression takes place in such a way that the cones, which are oriented in opposite directions, can maintain the desired position of the tissue and the projection of the adipose tissue in the malar area. This procedure is performed by using one hand to compress the adipose tissue and the other to apply traction to the external part of the sutures. Once the desired result has been achieved, we use sterile scissors to cut the external ends of the sutures by applying a mild traction to the skin using the tips of the scissors. Now we will insert the soft sutures in the second side. We create the entry point with a 19G needle. We introduce the first needle vertically to a 5 mm depth inside the adipose tissue. We rotate horizontally and continue introducing the needle until it reaches the distal exit point. We cut the needle and apply traction to insert the first 4 cones inside the adipose tissue. We proceed with the second part of the suture by inserting the needle vertically to 5 mm depth in the tissue. We rotate horizontally and continue until it reaches the proximal exit point. Once the needle has been cut from the suture, we apply traction to introduce the second set of 4 cones inside the adipose tissue. We proceed with the next suture, bearing in mind that all the steps must follow the same insertion technique. There are 2 key stages in the insertion process. The first one is to create an entry point with a 19G intramuscular needle. The second one is to insert the needle of the suture vertically to a 5 mm depth inside the tissue through the entry point. This will assure the correct depth of the insertion. Then we proceed to rotate the needle to a horizontal position parallel to the skin in order to insert it until it reaches the distal exit point. Once the first 4 cones have been inserted, we proceed to insert the second part of the suture. The needle must be inserted through the same entry point in a vertical position to a depth of 5 mm. Then, we rotate the needle horizontally and we proceed to the insertion until it reaches the proximal exit point. Likewise, we proceed to insert the last suture of the second side of the face by creating the entry point with a 19G needle. We proceed to insert the first needle vertically, rotate horizontally, and insert the needle and the suture with the cones. Then we insert the second needle, always from the same entry point, in a vertical position to a depth of 5 mm, with a horizontal rotation and insertion until it reaches the proximal exit point. At this point, we must apply the same traction to the sutures by compressing the adipose tissue with one hand and applying traction to the external ends with the other. Once the desired result has been achieved, we use sterile scissors to cut the external ends of the sutures by applying a mild traction. The use of fillers during a silhouette soft treatment allows to obtain optimal results if we need to correct the ptosis of the tissues and to restore the volume in the malar area. This will assure a natural result. In this case, sub-Q is used with a 27G cannula and 0.75 cc of filler are injected on each side.